So welcome. Welcome. This is the first of our 2026 series of horse owner educational webinars from the American Association of Equine Practitioners. We are really pleased that you decided to join us this evening. My name is Karen Pouts. I'm Director of Education for AAEP, and I'll be the moderator for this session. And also I'll be running the slideshow. So you'll hear everyone ask me to go to the next slide, and that's cool. The American Association of Equine Practitioners is the world's largest professional membership association for equine veterinarians and vet students. And there's a good chance that your personal veterinarian is an AAEP member. One of our primary missions is to deliver the latest treatments and research in equine veterinary medicine to our veterinarian members. This mission extends to providing quality information about the health and welfare of the horse to the clients of our member vets. We very much appreciate your commitment to your horses by being here with us tonight. This webinar is entitled Equine Dentistry, a close-up look inside your horse's mouth. Our panelist experts on this subject are Drs. Kim Allshouse, Dale Kelley, and Leah Limone. And once we get started, I'll let them introduce themselves further. But first, that quick bit of housekeeping. Please understand that we're not able to answer questions specific to your individual horses. Save those questions for your personal veterinarian. However, we do hope you take advantage of the interactive nature of this webinar and chime in with your questions and your comments using the Q&A and chat features. And also don't forget that reaction button. We'll try to get to as many of your questions as possible. It works best, again, if you put your questions to the panelists in the Q&A box, but we'll keep an eye on the chat as well. And a quick shout out to Kevin Hinchman. He's our IT director, and he's standing by behind the curtain to help us in case we have any more technical difficulties. But I think now I'm going to go ahead and pass things over to Dr. Kelley to get us up and running.
Hi, everybody. Thank you for being here. I'm Dr. Kelley. I'm actually at Oklahoma State University. I feel like I'm a bit of the oddball in this group. Dr. Allshouse and Dr. Limone do dentistry on a day-by-day basis and are, either specialists or pursuing a specialty in dentistry. I did an internship that was had a lot of dental focus in it, and we did a lot of dental work. But my residency, I ended up going to the opposite end of the horse, and I'm actually a specialist in equine reproduction, just to kind of give a full disclaimer. So I'm going to kind of talk a little bit in the beginning, probably the easier stuff, some of the physiology, anatomy, some of the basics, and they will go into some of the more difficult and advanced things with diagnostics, diseases, treatments, and things like that. So I guess if we can go to the next slide. It doesn't look like it's advancing. And somebody says they don't see any slides.
Yeah, I know. Zoom is being silly, so I'm making sure
That's
that
okay.
things are working correctly before we get it started. And so we are almost there. Okay. All right, thumbs up, you guys. Are you seeing it? It should say Equine Dentistry, a close-up look. And let me make sure I can get forward a slide. Yes, look at there.
Perfect.
I just love seeing all those thumbs up. That's really fun. I'm just going to keep asking everybody to do the thumbs up because it just makes me giggle to watch it. Okay, go for it, Dr. Kelley.
All right. So I guess if we go to the next slide, the one with basically the goals for so these are kind of our goals. I think dentistry is incredibly important. I think, people tend to neglect it. You see a lot of times broodmares have bad feet and bad teeth, and I think this is something that, it's things that need to be paid attention to, either in horses in the pasture or high-end performance horses, the whole spectrum. And I think, hopefully we emphasize, in this talk tonight, why it's important. Kind of give you guys a little bit of familiarity with the anatomy of, the horse's mouth, preventative medicine, sort of give you an idea of, why it is important, when to do it, so on and so forth. And then, the other doctors, Allshouse and Limone, will talk a little bit about, diagnostics, treatments of diseases, common problems, and different types of things that can be done. Hopefully, not so much to teach you what to do, but what your vet might be talking to you about or recommending, and why they're recommending it, and the importance of doing these different things. We could advance, please. All right. So why is it important? So if you think back evolutionarily, thousands of years ago, what horses, originally were eating grasses that had a lot of silicates in it, and they were very abrasive. So, their teeth have basically evolved, to, deal with, this abrasive material over time by the way they erupt and wear. And then as, things have changed over the centuries in terms of management and domestication, we've gone to, different feeding schedules, the pastures they get don't have, they have really good grasses, but they're not as abrasive and things like that. And all of this can affect how these teeth wear over time, and consequently impact, how they're managed, and, raises the importance of doing routine dental care to try to prevent, a lot of different, sharp points or other diseases that can happen. You know, Also, if you're riding your horse, if, dental alignment is not good, all of these things can impact how the horse accepts the bit, and also consequently performs in any type of competition, or even just with daily or recreational riding for that matter. And, I have to say, in terms of breeding, when we breed, dentistry is something not a lot of people put a tremendous amount of thoughts on. Some of it does depend on registries. Some registries, will, actually, have like a full examination, including a dental exam, to make sure that, they don't have any kind of congenital abnormalities. But overall, there's a lot of registries that may or may not pay attention to this, and I think it's something that deserves consideration. And then also when you get to, our older horses, there's a lot of changes that occur over time with how their teeth wear, what they have left, how they chew, diseases they may have in their mouth. So, that's going to change, how we manage them and how we deal with them, and things that we need to consider as we go through. Next slide, please. So some of the goals of good dental care is, one, just, making the horse, comfortable, having a high quality of life, avoiding problems, with their bit, being able to efficiently utilize the different feeds. Prevention is always important. An ounce of prevention is worth a pound of cure in my mind, and that's a bit of an old adage, but I think it always applies to what we do. And the thing is, people often neglect these dental cares in young horses, but I think it's really important, even horses as young as yearlings, or even foals for that matter, to have their mouth looked at to see if they have any problems that may need to be dealt with before they get older, and the chances of being successful may diminish. And then old horses are the ones we think of commonly having dental issues that need to be addressed, either through dentistry or daily management and how we feed them and things like that. And paying attention to this, it's not something, you just do once and forget. It's something you need to kind of pay attention to, on a fairly frequent basis. And that kind of depends on the individual horse. You always have to think, these are, each one is a little bit different, and how the, wear and tear on their mouth can vary, depending on how they're managed, their environment, their genetics, and a whole lot of different factors. So, those are all the kind of the goals here, really to maximize the health and welfare, for the animal. And then, hopefully, if they're being ridden, maximize things so, the riders can optimize, the performance, So, if you have a happy horse, hopefully you have a horse that's performing well. Next slide, please. So this is just a little bit of a nutritional requirements. I think dentistry and nutrition are, entwined intimately. So you have to remember, horses need to be grazing the majority of their time. If they're, a lot of our, performance horses, the way they're managed doesn't necessarily allow this. They may be stabled for competitions, getting, you know, feed fed at certain periods of time. Ideally, you'd like to have some kind of forage or something in front of them the majority of the time so they can kind of at least mimic that normal grazing behavior. Um, and that forage, as it says here, should be, a majority of the diet, minimally 60%. But ideally the more is really the better just because the way their body's designed, they're really designed to eat all day. They're not, like us where you can sit down and have 3 meals and then sit the rest of the day. There's not just the dentation, but other parts of their anatomy they're just really not set up for that. And the size of these particles is important, the way their teeth kind of work. And we'll touch on that a little bit later, plays a big role. So, kind of reiterating, proper diet is important, and forage and pasture plays a very important role in this. Next slide. All right, so this is sort of basic dental anatomy, and this is where I always wish I had like a pointer. So the incisors are basically, if we're looking at the bottom picture of the skull on the right, the incisors are really those front teeth that are kind of pointing to the right, a little bit more over to my right.
I'm
Um,
not sure which way is your right. So,
oh, sorry. The ones that are most rostral or most towards the very front of the head. Um,
okay,
oh, okay.
I'll stop trying
So
to be helpful.
that's okay. That's okay.
They're the
Um,
ones that if you flip up the lip that you can see.
yeah. Thank you.
Yeah, duh, those. Thank
Yeah,
you.
right
Good
there.
Those
job.
ones, yep.
Yeah.
And then kind of moving the opposite direction. The next you would in some of them you can have canines, mostly male horses. Some mares can have canines. Generally, they're on the upper jaw, but sometimes you may or may not have these. And then the next set are going to be what we call the premolars, which are, kind of, I guess, between the little red dots and that vertical line. They're kind of in the front part there. And then the last ones behind that line towards the back of the head, those are going to be your molars. And so you think about it, your incisors, really, they go down to the ground, grab the grass, kind of break it off, and then those molars and premolars do a lot of the grinding. And they kind of actually grind in a bit of a side to side motion when they do it. And I think there's a couple of slides that'll kind of give a little bit better illustration of what I'm talking about. And then the canines really are, kind of left for mainly for the males, just for, fighting purposes. A lot of times they don't serve a lot of, role in actually, the way they masticate the forage or anything like that. Next slide, please. All right, so this is kind of showing kind of a bit of anatomy of an individual tooth, and this one looks like an incisor. So basically you have the crown, which is the part of the tooth that you can see, and then the root is the part that's basically you can't see, that's below the gum line. And there's different parts of it. The most outer part is the cementum, and then you have a layer of enamel followed by dentin, and then the pulp cavity is the very center. And in that side, that pulp cavity, you have a lot of different structures that we'll kind of touch on a little bit later. And then you've got, the view here kind of showing the upper jaw and the lower jaw. And generally the upper jaw is just a little bit wider than the lower jaw, and they actually have to kind of chew in a side to side motion. And a lot of times with modern feeds and everything, especially grains, they may not, have to chew in such a dramatic side to side motion, which can alter how the teeth wear, causing you to get a lot of sharp points. Generally on the upper jaw, they'll be on the outside or on the cheek surface, and on the lower part, you may get points and on the basically the lingual or inner part of the tooth. Next slide, please. All right, so this is kind of showing a picture inside the mouth. So you can see the canines there labeled. So either this could potentially be a mare, but more likely a male horse. And then the first premolar this is wolf tooth. And these may or may not be present in all horses. And a lot of times they are removed for horses for riding purposes, as they sometimes can interfere with the bitting. Sometimes the bit can kind of clack against it and the horse don't like it. And next slide. All right. So this is kind of where we talked back to a couple slides ago, talking about the anatomy. And in this pulp part, this is really where a lot of the live structures are. So you've got nerves, you've got blood supply and lymphatics. So anybody who has had like a cracked tooth or something and it hurts like all bejesus, that's that nerve that's being exposed and it can be incredibly painful. So as the horse chews, basically the surface kind of wears down over time, and basically seals off, preventing these from being exposed so they don't get a pain when they, chew basically. And that's under normal circumstances. When things go awry, if that tissue is exposed, it can be incredibly painful, and that's what horses can get extremely reactive. Next slide, please. All right, so this is kind of where we get to how the teeth erupt. There might be some misconception that the teeth grow throughout their life, but they really don't. They're born with a certain amount of tooth, and it basically just kind of becomes more, or doesn't. I'm trying to think of the proper terminology, but without saying eruption. But basically, it just kind of elongates out of the jaw as it wears out. So you're not actually gaining more tooth. You only have a finite amount of tooth for the life of the horse, but as it wears, it basically kind of moves upwards. So it keeps providing a little bit more. But, as horses get, if they live to extremely geriatric ages, you could potentially run out of tooth over time. And, in the first 5 years of life, basically they erupt about 68 teeth and they lose all of their baby teeth. And, I don't know if most of you, if you've had foals or not, but a lot of times you'll see them, they kind of get like their first two incisors really young and they kind of grow out for those deciduous teeth or baby teeth. And then as they grow older, they'll, some of these will, basically lose their baby teeth, much like people do, and grow adult teeth. But this can take up to 4.5, 5 years of age before, they have their whole set of adult teeth in. So, basically, the way I think about it is they always try to have a full head of teeth. Their head's a lot smaller when they're young, but the teeth are still fairly large. So as their head grows, they start to develop more teeth that start to come out and basically fill up that space so they can maximize their chewing capacity for the forages that they graze on. Next slide, please. All right, so we classify horses hypsodont, which basically just means that their teeth are constantly or erupting, but they're not really growing. So like I kind of alluded to that they do run out of teeth. Generally, they'll erupt about 2 to 3 millimeters per year. And there's a little bit of a reserve. So you can see in this little picture here with the coin, basically showing you a tooth of a 7-year-old all the way up to a 30-year-old. And you can see, when they're younger, they've got a lot of tooth there, but over time, as they chew and wear it down, it basically gets smaller and smaller till, to the very far, that 30-year-old horse just has little nubs of teeth left. And you can imagine the impact that can have on grazing, utilization of anything they eat. If you've got less tooth, they might be right on the gum line or something like that. So it makes it really hard for them to get very effective chewing. So, they might, drop feed, and they might have a hard time maintaining weight and things like that, just because they can't really, process that feed before it goes in the digestive tract. And that can really diminish, how effectively they can digest it. Next slide, please. So these are some of the different factors that can influence tooth wear. Diet is a big one. If they're on pasture versus eating a high grain diet, it can affect not just how fast the teeth wear, but also the patterns of wear. Each, animal's an individual. Some are born with really good teeth. Some may be born with not very good teeth. And, also within that, how the teeth align. They could have really good alignment, or they could have poor alignment. And that alignment can affect how they chew and how the teeth basically wear over time. And then, over time, animals can have problems. They might have missing teeth or things like that. And what can happen is, the tooth that's on the opposite side of a missing tooth doesn't have anything to wear against. So basically, it'll get longer than the other teeth because it's not being filed down. It's almost like if you filed your nails every day, to keep them short. If you quit filing one, it just is going to grow really long while the other ones stay maintained short. So it's kind of the same idea, if they've got missing teeth. And in those type of individuals, it may be important to do more frequent floats or, on them to try to keep that tooth from becoming malaligned, because that can also affect chewing patterns. So, this is where your dental care becomes really important. And management also becomes important as well to try to prevent a lot of these lifelong problems. So, proper dental care is very critical. If you're too aggressive on these floats, you can actually cause more harm than good. So, you want to make sure you get a good professional who knows what they're doing. Qualified veterinarian is very important. Next slide, please. So this is just a chart, and I will fully admit this is something I always never remember any of it, showing at what ages different teeth are erupting. So you can see, your baby incisors are happening for the first 9 months, and then also you start to have these first, second, and third cheek teeth. And then on the opposite column, this is when your permanent teeth start erupting. So you can see, to get your full adult teeth could take up to 5 years. So this is not a quick process. It can kind of go over time. And paying attention through these different phases can be really important because, you could have deciduous teeth that basically are being retained and having a hard time, popping off. And you might want to get these things examined, and this kind of illustrates the importance of not just dental care in an adult horse, but also paying attention to these things in young horses as well to make sure that all of these benchmarks are basically happening in a timely and correct fashion. Next slide, please. All right, so kind of going into the structure. So basically, you can think of these. So you've got these three different layers: your cementum, your dentum, and your enamel. And the enamel is in the middle of those first two layers. And basically, you can think of it as they're chewing. They're kind of the side to side motion, so they're almost like sharpening or honing their teeth every time they eat. And the enamel is actually is thought of as a very brittle layer, and it's sandwiched between these other two softer layers, and that kind of helps with the structural integrity of these teeth to give them a really good hard surface that can is not just going to fall apart, but be relatively rugged and allow them to chew properly and have good wear. And this you get this differential wear depending on patterns. You can get different, and they'll talk a little bit more later about some of the different things you may see where basically the arcades don't form a perfectly straight line. You could have waves or things like this, and it just depends on that chewing pattern of that horse as it goes through life. And proper dental floatings can help kind of try to correct these things and maximize their chewing ability. Next slide, please. So, basically, because they've only got finite tooth, they're wearing these teeth out. And, over time, they've, really only got, a certain amount of teeth that they have for their whole life. So as they get, different terms, that you can see for these could be a cup teeth, expired teeth, or a smooth mouth. But what happens is, they don't really, as they wear, they really lose proper grinding function. So they don't really, properly process and the feed. And you can see what's called quitting, where you basically get, like balls of feed in the mouth that kind of get spit out. And, this can increase the risk for other problems such as choke or impaction colics. Just because they're not, processing the feed into fine little particles, it's kind of coming into big chunks because they're not able to really masticate it very well. Next slide. Next slide. Yeah. So, what do you do from, this is kind of looking at from a management standpoint. So in these older horses or horses with, really poor or cup teeth, you can think about, first, trying to get short stem forages that don't require as much chewing, softer forages, soft grasses, chopped hay. Those can be really beneficial, just things that, minimize how much effort it really takes to reduce the size of the forage. You can utilize things like mashes, such as beet pulp, rice bran. You can do soaked pellets or soaked hay, just to try to minimize how much effort is required to actually break down these feeds. They also make complete feeds, which are basically feeds that are balanced in such a way that you don't necessarily have to have forage in their diet. They provide all the vitamins, minerals, roughage that they need in that particular feed. Additionally, in older horses, you could also use senior feed. Some of them are complete feeds, but I think you have to pay attention to the actual feeding instructions and what the manufacturer labels them as. Because if they're not complete feeds, you still do need to have forage in the diet. But generally, a lot of these have a little extra fat in them to try to help, keep the weight up on these older horses. And, nutrition is something you probably have a whole nother talk on, and just kind of skim the surface. But these are just some things that you can consider doing in horses that, have like, really poor teeth that have worn out over time, just to try to maximize the nutrition that they can get out of these feeds. Next slide, please. So, routine preventive care, these are things that I think are extremely important. I think an an oral exam, I think, is probably one of the most important things that you can do. Basically, you're trying to identify these problems and manage ones that you find ahead of time. And you can see on my left, the picture of the teeth. There's a pretty nasty hook there. You can see some really abnormal wear. So you can imagine, if these teeth, basically have to kind of grind against each other when they're chewing, you can see that it's going to be incredibly difficult. That mouth's not going to be able to function correctly. So this is things that you really need to take care of. And you can remove these sharp points. The lay procedure is called floating, but basically you can get in there either, with mechanical or the old-fashioned files, but basically getting in there and reducing these points to try to maximize, the ability for those teeth to kind of get occlusion or contact fully across the surfaces and move properly for chewing. And then, we'll also talk a little bit tonight about diagnostics and treatments. But basically, X-rays are incredibly important because there's no way to really evaluate what's going on in the root of the tooth just by looking at it. We can do different things during an examination procedure, but those X-rays can really provide a lot of information to things that we can't really see that's going on below the gum line. Next slide, please. All right, so this is kind of a little bit showing you veterinarians. Basically, there's a lot of education. I think everybody already knows this. They go to undergraduate school, we go veterinary school, internship residencies, and there are people that specialize in dentistry, and they're licensed. We're all licensed, as well as we have to do continuing education and different things such as dentistry for one, just to maintain not just our level of knowledge, but also improve our level of knowledge with what is currently going on and the most modern things out there. So, this is a really good resource for people to look at, what's going on with your horse, looking at, their dentistry, lameness, different areas. These people, that were very well educated in a wide variety of things. And there are people that go on and further specialize, such as, with the American Veterinary Dental College, particularly in dentistry. And, next slide. And so, for example, with the American Veterinary Dental College, basically, these individuals have, advanced training, specializing in just dental work. But then, to be boarded, they actually have to prove that they meet a level of competence through examination. So this is a way, that you're really getting somebody that really knows dentistry through and through and has a guaranteed minimum level of competence. So, I think, when you're looking, at, who, to hire, to look at the dental, an equine veterinarian is a good place to start. But if you have more difficult problems or things going on, that's when a specialist, I think, is critical, because that advanced training, they can, believe it or not, they can do root canals and things like that in horses, and, different procedures that, a lot of time, I know when I was a child, I would have never thought was possible. Next slide. All right. So, what is the visual exam? So basically, you're going in there and you're trying to see, basically how the teeth look. What type of anatomical problems do you have? Are there missing teeth? Are there extra teeth? How do the teeth align? Anything like that. And probably, one of the most important instruments is actually a mirror. And you can kind of see that's what's on that little picture there is they're using a dental mirror because the way the horse's mouth is really hard just to open it and just take a quick peek and see what's going on. You really need, a way to reach to the back to actually visualize. Sometimes people even use things like endoscopes or things like that to really get back there so they can examine what's going on. Other things, you're looking at are like periodontal disease. So basically, you think of it as gum disease. They will get in there with different probes, probing around the teeth, looking for pockets. things like that. Even scratching the surface of the teeth with basically little sharp hooks to try to identify any kind of abnormalities, such as cavities, fractures, anything like that. And then, they're also looking for any kind of soft tissue injury. So, for example, when you get these sharp points, you can imagine you could start, having those rubbing on your cheek or your tongue when they chew if they get large enough, sharp enough, and bad enough. And then also, you can look at, the sinuses, particularly, on that upper jaw and those back teeth are, those roots are very, very close to the sinuses in their head. So if you start getting, disease in these roots, it can actually feed up into the sinuses and cause huge problems, getting sinusitis and sinus infections and things such as that. So you can see all this stuff, can kind of, snowball into being bigger issues if you don't really pay attention. And this is where that, proper visual exam is very critical. Next slide, please. So, where can you do this? Really, you can do it just about anywhere. You can do a lot of stuff on the farm. Sometimes you may opt to do it at a veterinary clinic. It really depends on, who you're working with, where they're comfortable working. Some certain advanced procedures, it may be better to do at a hospital setting just because of access to different tools or equipment. But, a general exam or floating procedure, that could be done really anywhere. So, it makes it, if you've got a bunch of horses, you can have a veterinarian come out to your farm and, basically go through the herd examining, their mouth. They could take x-rays there, they can float the teeth. And then, if they've got, something more advanced, such as, a tooth that needs to be pulled or something like that, they may, opt to do that at the hospital, just depending on the resources and their comfort level, and how bad basically the problem is, and what needs to be done. Next slide, please. So this is kind of giving you an idea of how prevalent dental disease is. So you can see basically gum disease or periodontal disease is pretty common. Half to three-quarters of the horses have it. And then cavities, a third of the horses. And then, you have different wear anomalies, malocclusions, maleruptions, idiopathic fractures just basically means you have basically broken teeth that we don't know why they broke, but they're just broken. And then also you can have what we call apical disease, or basically it's an infection of the roots. So this is, the goal basically, of that proper, of a good visual exam or a good oral exam is to try to identify which of these or, is going on, and then developing, further diagnostics if needed, and then treatment options ultimately to try to, mitigate the disease and hopefully get it back to being a healthy, normal mouth in the future. Next slide, please. All right, so this is kind of walking you through, like what is an oral exam? How is it done? Sedation is, critical um, for this type of procedure, because you can imagine a horse doesn't want to have its mouth opened and looked into. So, that really plays, probably paramount, just a little bit of sedation just to relax the horse, make them comfortable with the procedure. And then you end up putting basically a speculum in their mouth, which allows you to kind of open the mouth so you can reach in, potentially feeling with your hand and putting dental mirrors or different tools such as picks or probes to try to, look around, get a sense of what's going on around the teeth, just to kind of get an idea of the health. The veterinarian is going to have a headlamp or something along that lines so they can really get a good light source in there to try to see what's happening. And as earlier we talked about, a dental mirror is a very critical tool to really be able to look back there to try to get an idea of what's going on with each tooth. You literally will take that mirror and look like tooth by tooth, just try to visualize, not just on one side, but on all sides, just to try to get a good idea of what the condition of that particular tooth is. And that's where these probes and explorers kind of go in. You might see something that looks a little abnormal, and then you try to get as best a feel as you can, because you really can't necessarily, if it's a really one of the back teeth, you can't really, it's not all that easy just to reach your hand in there and feel what's going on. You might have to use other pieces of equipment just to try to gauge what the health and condition of that tooth or surrounding gingiva is. Next slide. All right, so this is kind of just a slide showing you some of the different tools. You can see, sedation. It's very helpful just to get the horse in a relaxed state, so you can actually put a speculum in, which you can kind of see on the very far opposite side with the person holding. You can see something in its mouth. that's a speculum, and then in that one it looks like they're floating or doing something along that lines. Next to that, you can see a dental mirror, a dental explorer, as well as a dental probe and a headlamp. And then the other two pictures are basically showing you how you're trying to open that mouth so you can really go back and visualize. You can see how far back those teeth run past the cheek. So it makes it really, it's not just simply, open the mouth like a dog or a cat and take a quick peek, just because there's so much tissue that you have to kind of, you know, look around and through. In a way, you're kind of working in a cave, I guess, to try to get an idea of what's going on back there. So that's why all these tools are very, very important and, helpful to really get a good, proper exam. Next slide. All right, so this is sort of the hows. So there's different equipment you can use. So we kind of talked about a speculum. A lot of times people use a headstand, or they may use something to kind of hold the head up from a support above, like a rope with a special halter. Stocks are really helpful just to kind of keep the horse from moving around too much. And these things are really, not just for the safety of the horse, but also for the safety of the doctor as well as the people working around the horse. Because, you can imagine, if if you're floating teeth, if you're doing, with, like basically a power instrument, or even with the hand float, there's a lot of chattering sounding and stuff, and that can be really unnerving. And some horses can be incredibly reactive to this. If you think about it, there's some horses that they can have like TMJ issues, basically in that joint back there, and the vibration can be really, really painful and alarming to them, and they can be very, very reactive to it. So this is really all trying to, make it, safe as well as the best welfare for the horse. Basically trying to make them, as comfortable as possible, because, you know, I don't like going to the dentist personally. So, and people can talk to me and tell me what's going on, where, you can't really talk to a horse and say, hey, we're going to go to the dentist today and do this. It's kind of like if I went to China and somebody just started, doing something in my mouth, and I'm like, I don't know what you're doing. So it's just trying to make it as best a situation as possible, because, they really don't know what's going on, even though it is for their best welfare. Next slide.
Okay, I think we are going to, Dr. Limone was going to answer a couple of the questions that have come up, and then a couple will be addressed later on. I know that there's a lot of EOTRH questions and things, and I'm gonna talk about that in a little bit. So,
Great. Yes, so I just want to address some of the questions that came up both in the chat and in the Q&A. I'll just sort of start backwards since we were just talking about the exam. With regard to sedation, so it is actually very necessary to use sedation to do a thorough visual oral exam in the horse. They're large creatures. Like Dr. Kelley was saying, we can't really just ask them to open their mouth and behave and let us do what we need to do. So sedation is very helpful to help quiet them down, help slow the tongue from moving. They're not stressed when we have to put the speculum on to open their mouth, so that we can actually see what we need to see for the exam. Once we can do that and actually do our diagnostic exam and determine whether or not they need to be floated, that's again, it's helpful because some of the floats do make noise, but the main part of it is that we need them to be quiet and settled for the exam so we can see what we need to see in there. For some of these other questions here, once a senior horse gets to the point of quitting and their nutritional needs are being met through senior feeds and hay pellets, are they still okay to turn out on pasture? That's a good question. Generally, pasture and soft grass is usually the easiest thing for them to eat. So, we've got a lot of senior horses that may be on a complete feed or short stem diet only, and they're generally still able to eat grass. They may quid and may spit out wads of hay, but generally grass is pretty easy for them to still eat. There's another question on here. Is it common practice for these teeth to erupt on their own naturally, or should they be helped along by an equine dentist or vet? We can't actually help teeth erupt. The body has to do that on its own. So we don't generally have much control over, or really any control over how fast teeth erupt. What we can help with is if there's a malocclusion for any reason, say the horse is missing a tooth, fractured a tooth, we can at least make a diagnosis and determine if a tooth requires extraction, if possibly instead of just floating sharp points, a certain area of the mouth requires floating or crown reduction to kind of decrease pressure on the opposite side, manage periodontal disease, and help manage things that way. That's part of the reason why we like to see them every 6 to 12 months for an oral exam, so that we can know what's changing and be able to address problems while they're still small problems, hopefully. Next question is, how much tooth does each horse start with? I think we had that slide back there that showed, sorry, I don't know what number slide it was, but it sort of showed the range of teeth by age. So, they can be pretty long, up to, maybe 4 inches in a very young horse, and then erupts about 2 or 3 millimeters per year, and then wears away about that same rate. So we always see the same amount of tooth in the mouth, but the difference is the amount of tooth that's below the gum line that we can't see without x-rays. You guys caught a mistake there. Yeah, that slide 7 and slide 8. There was a line that was deleted pointing to the actual wolf tooth, but it got mixed up with slide transfers. So the wolf tooth is technically the first premolar and sits right before the first real cheek tooth, and then the canine teeth are a little bit closer, sort of in between the incisors and the cheek teeth. Can poor dental health be passed on to offspring like conformation can? I'll pick on minis if I have to pick anything. I love minis, but their poor little teeth don't fit in their head a lot of the time. So, minis have a lot of issues with crowding, rotated teeth, missing teeth, extra teeth, because their teeth literally don't fit in their head. So that is one problem, particular to, we'll say, a specific breed there. Unfortunately, teeth are pretty hidden structures. Like I said, you really need sedation, speculum, light, mirror or scope, the mouth rinsed out, and a good way to really look at the mouth. And there's not a lot of breeders that likely are going to do that before they decide to breed a breeding program. Let's see. The EOTRH questions, we'll get to those. Dr. Allshouse is going to go over EOTRH quite a bit, and we're happy to answer more questions about that later on. And let's see. Prefer a manual float with traditional files or a power float? And can you talk about why you might use one over the other? That's very operator dependent. I can tell you personally, I would much prefer to use motorized instrumentation, or like a power float type. And the reason being is that you're able to actually see every tooth that you're on instead of having to go by feel. And I would much rather do a focal treatment that I can see and know exactly where I am in the mouth and know exactly what I'm taking off, rather than trying to guess by feel. But that's very, kind of a personal preference. How often should x-rays be done? I'm sure Dr. Allshouse is going to address that. And then with cats and dogs, there are methods marketed to reduce plaque, including things to chew or dental scraping. We don't really have anything to help reduce buildup for periodontal problems, but we do end up with a lot of horses on daily oral rinse. And that may come up a little bit later too. So I think that's it. I'm going to turn it over to Dr. Allshouse to go into her section. Keep the questions coming though, they're great.
Hi, everybody. I'm Dr. Allshouse. I am a third-year resident. I work with Dr. Limone. She didn't introduce herself, but she is the one of us who is board certified. So she is officially a dentist. And I am on my third year of residency. So let's jump back in and start with some dental diagnostics. So your first line of defense is going to be your oral exam again. And this first picture, the top left picture, where you're looking in the mirror at a tooth in the horse's mouth, If you look to the left of the mirror, there's two dark areas. Those are pulp horns. Those should be completely dark brown, but rather this tooth has food in those pulp horns. So that is an indication for radiographs. And that is something that without a quiet tongue, a good light, a mirror, or an endoscope, you're just not going to see that. There's no way that you're going to feel that by reaching in and just kind of feeling around back there. So thorough oral exam is number one. Number two is digital radiography. I think most veterinarians have digital radiography. Whether or not they do a lot of dental x-rays, that would be a conversation to have with your veterinarian. But it definitely gives us a better look. And sometimes it is absolutely impossible to tell, like that tooth with those two defects, that tooth, we may look at it and it may be completely fine on radiographs, or it may only have one defect and look absolutely abysmal on radiographs. So it's very hard to tell. Endoscopy, again, can be very useful. That's when we stick a little camera in there. Sinoscopy, if they're having sinus issues, we can go into the sinus with a camera. And also CT scans. These are very, very helpful. The middle bottom picture is a CT scanner. That's actually a one where they have to lay down, but there's many facilities now. It's becoming much more common for people to have, for facilities to have standing CTs. So we will often send horses for standing CTs, especially when they have either a very complicated tooth or sinus infections, or there's some other question that we need further information for our surgical planning. So this lower right picture is a horse with a sinusitis there on the left side, and you can see the right side has a lot more air in it, and there's a lot more gunk in the left. Next slide, Karen. So a little bit more about radiography. Again, it helps us visualize sinuses, tooth roots, and surrounding bone below the gum line. The digital radiographs, it's very useful because a lot of times we can get an answer in the field. Sometimes the answer is that we need more information, but usually we can get at least some sort of answers in the field. And they can also be transferred very quickly and sent to someone, if your veterinarian is not a dental specialist, easy to send those out, take a snapshot of it, and get some more information through the phone a friend technique. So we are always here and happy to help. The image of the incisors kind of there in the middle, you can see one of those teeth, they all have kind of these straight long roots, and one of them looks like it's curving way off to the side underneath the other tooth. Exactly. Thank you, Karen. And this is a really good example of why, no, we can't just pull the tooth. We need to do radiographs because we don't know that root is kind of diving off to the side. And if we started doing that without the proper information, we'd find ourselves really frustrated. All right, next slide. So what is odontoplasty? So we've covered this a little bit so far. It's more commonly referred to as floating. Floating is an old masonry term. It means to spread smoother level. So when they would pour a bunch of concrete, they float it to make it level. It's a little bit of a misnomer because we don't really want to make teeth level. They need those ridges. They're very important. They use those to masticate and chew their hay. But what we do need to do is remove these sharp enamel points that they like to get. As Dr. Kelley mentioned, they get these on the outside of the upper cheek teeth. You can see that in the top left picture. Right against those cheek, that horse has some pretty sharp points. And then they'll also get them on the tongue side of the lower teeth. Geriatric horses, which this top left picture is an example of, can get some really abnormal wear patterns because the teeth don't always wear out in the same at the same rate. So here in that picture, there's a space towards the back where it doesn't look like there's a tooth. There actually is a tooth. It's just very worn out. So that means the tooth below it is going to get a little bit over tall and needs to be addressed. All right, next slide. So again, we'll do our oral exam. We'll decide whether or not that horse has sharp enamel points. And if they do, where do they have them? Some horses will get enamel points mostly towards the caudal molars. and they'll really cause some mucosal irritation. And some horses might have they might have one tooth that's tipped one way or another. That tooth might need to be addressed individually. Again, this is where the exam comes in, and we know, okay, this spot's getting a little bit more sharp, that spot's not, and we can be a lot more precise with our float. All right, next slide. So here is a before and after. So again, focal odontoplasty refers to the reduction of sharp enamel points. And this is something that, again, we're going to decide it's a treatment based on the diagnosis of sharp enamel points. And some horses, when they're younger, will actually get sharp a lot faster, and it's hard to know if they are or not. So their teeth tend to erupt faster when they're young, usually until around the age of 7, and those horses might actually benefit from twice annual odontoplasty in order to really keep them working well in their training schedule. Now, what you can notice about these pictures is the ones on the left and the ones on the right, the only thing that we've reduced is those sharp enamel points that are stabbing into the cheek. Correct. I always tell people we want to take off the stabby bits, but if you look at the teeth on the other side, the stabby bits are gone, but all of those ridges have not been touched. All right, next slide. Again, to float or not to float, a lot of times I hear this all the time that, oh, my horse doesn't need his teeth done because he doesn't have many teeth left. And usually that is not the case. There are usually some teeth back there. Whether or not they're useful teeth, I don't know. I have to do an oral exam. But there's definitely teeth back there most of the time, and they probably need some sort of care. So you can look at these pictures. The top left picture, that's a horse that has some pretty significant food packing in between two teeth. We commonly see that in older horses. That will lead to periodontal disease. I'll talk about that in a bit. You can see that we've got teeth that are worn to the gum line, teeth that are too tall because other teeth are worn to the gum line. So some of these teeth, because they are so worn out, can actually get really, really razor sharp. So I've seen geriatric horses with some incredibly sharp points and some big lacerations. So these guys definitely still need dental care. And that way we can tell you what kind of shape their mouth is in, and we can have a conversation about nutrition. All right, next slide. So I think someone had asked this question, motorized versus hand. So as Dr. Limone said, you can get really good visualization with motorized equipment, which can be a lot more difficult with hand floats. The picture on the left is the setup that we use. It's got water cooling and a vacuum. It's a little bit fancy, but a regular old power float works just as well. The hand floats, there are some people who are very gifted and can do a really great job with hand floats. One of the disadvantages of a hand float is that how it works is it cuts when you pull back. So because of that, if you think about it, if you have a tooth in the back of the mouth that needs a little bit extra attention, you are required by the laws of physics to float that tooth and all of the teeth in front of it. So as opposed to a motorized hand tool, we can be a lot more precise and just go back and get what we need to on that one specific tooth. But again, there are lots of people who do a good job with hand floats, but it's a slightly different skill set. Next slide. All right, common dental problems, and we're going to go through some of these. So, but just to give you an idea, we see sharp enamel points, malocclusions that can lead to hooks, ramps, wave steps, things erupt weird in horses sometimes. Gingivitis and periodontal disease. This can result in loose teeth and sinus infections. Decayed and fractured teeth, incisor and canine tooth disease, which we are going to cover, EOTRH. Oral neoplasia or cancer, and then any sort of soft tissue injuries. Sometimes these come from bits or equipment, and sometimes it's, again, from things like sharp enamel points or whatnot. All right, next slide. So does your horse's mouth hurt? This is a tough one. So some some clinical signs that we will see that can indicate that your horse is having some sort of dental difficulty can be the ones that we always think about, right? They're slow to eat, they're dropping grain or hay, they're quitting, maybe they're salivating a lot, shaking their head. They don't want to, they're not reacting to the bit like they normally do. They're tilting their head. They keep having repeated episodes of choke or colic that you can't really figure out. Any facial swellings, either on the mandible or anywhere over the sinuses, nasal discharge, odor, weight loss, poor performance. It's a pretty big list. And the really tricky thing is, it's often you see nothing. Unfortunately, I mean, it is what it is, but horses are prey animals, and they, regardless of the horse, no matter how few instincts we may have bred out of them, they still know that they have to eat. And they tend to just soldier on and they will continue eating. So a lot of times we don't notice until after the fact, or you may not notice at all. But a lot of, if I feel like if people often do notice, it's because the horse improves after whatever treatment has been performed. All right, next slide. All right, so hooks. Everybody hears people talk about hooks. Here's a little example. This is one way that they can develop. They can certainly develop from other things, but an overbite or an overjet is an example. With those, a lot of times we will see the most rostral upper cheek tooth will get a hook, and the most distal lower cheek tooth will get a hook. And those, depending upon their location in the tooth, if your horse does have an overbite, this horse may need to be seen more frequently to keep those reduced. And the reason is because they just don't line up correctly. And so some of those teeth just don't wear down while they're chewing. So, all right, next slide. Wave. I'm sure most of you have heard of this. It can happen for a couple of different reasons, but it usually happens because one tooth is not wearing against another tooth in a manner that it's going to wear down evenly. So older horses will get this when, again, their teeth start to wear out and become smooth, cupped, expired, and the tooth below will erupt and not have anything to grind against. So it will just continue to erupt and it can cause issues. All right, next slide. A step or overgrowth. This is a similar thing. This can also cause issues. Both of these, all of these malocclusions can affect both the front to back motion of the horse's mouth and the side to side motion. So the side to side will really affect their ability to chew well and masticate their food. And the front to back motion can really interfere with bitting. So when you go to ask a horse to come into a frame or go on the bit, sometimes we'll see things like they gape their mouths, and that can sometimes be because they have a tooth that's overlong and it's not allowing their mandible to slide appropriately. So these can definitely cause some major problems. All right, next. All right, so periodontal disease in horses. This is usually caused by, to start, a diastema, and then they will go on to develop gingivitis. So a diastema is simply an abnormal space between teeth. So horses' teeth should fit together very closely and there should be no spaces in between them. But a couple of different things can happen. Number one, we don't all have teeth that fit perfectly together. So they might just have natural spaces somewhere. Their teeth could be offset a little bit, and this can sometimes create an opportunity for food packing. Also, as they age, horses' teeth get more narrow towards the base. So sometimes they'll just get this as they age. Some spaces will just appear between their teeth. And what happens is food gets trapped. It sits there. They don't floss. It doesn't matter how much I ask. It rots, it ferments, and the bacteria from that will cause breakdown of soft tissue, breakdown of bone. You can see, I know, they don't floss. I've tried. You can see on the second top picture, that's an example of a lot of, there's soft tissue loss there. Yep. There's soft tissue loss, there's bone loss. And if you look at that from the top, like this is the side view that we're seeing. If you were to look at it from the top, those teeth might look really close together because that particular diastema is what we call a valve diastema. So food gets shoved in and then it can't get out. Radiographs can be very helpful with this disease. It allows us to see whether or not there's bone loss between the teeth, and that's how we score periodontal disease. And it also lets us know the vitality of the teeth associated with it. All right, next slide. So here is a little bit, some more examples of periodontal disease. So you can see, this is actually a really good radiograph. The space on the left, that is a space that has already been cleaned out of food, but when you looked back there, you would have just seen food stuck between two teeth. And you have no way of knowing how deep that space is unless you really get in there, clean that space out. And once you discover that it's this space is an abyss, once you discover that, then definitely radiographs are indicated. And if you look at the radiographs on this tooth, there is a space between those two, the fourth and fifth tooth. That's the first and second molar, where there is a large space. Up more, Karen, the top ones. Yep. Yeah. So that space that goes all the way up to the tooth roots. So that horse can pack feed all the way up to those tooth roots. And when that tooth was extracted, if the picture to the right, you can look at that tooth, and all of those extracted teeth should be covered in that pink red tissue. That is the periodontal ligament that holds the tooth into place. And the fact that that tooth is missing half of that means that it's been eaten away by disease and the bacteria that we were discussing earlier. That bottom right tooth, that's actually the root that you're looking at. And you can see there's actually food kind of stuffed up and over that root. So they can definitely cause some significant problems. All right, next slide. So what do we do for periodontal disease? This is just an example of one thing that we can do for management. A lot of times will start with having owners put their horses on a daily dilute chlorhexidine rinse. There are some veterinarians out there. There is some top dressing products that I know that people have used. I haven't used them a ton, but there are a couple of people that I've talked to that kind of like them. I need to do some more investigating there. But for the most part, any sort of like oral rinse, what that's going to do is it's going to help control the bacterial overload that's associated with that food packing. Again, they don't floss. It's the only way that we can get any sort of antimicrobial action back there. And then from there, what we can do is sometimes we'll pack these spaces. They need to be cleaned. They need to be debrided. And then sometimes we'll pack them with dental impression material. That's the blue stuff there in that right picture. And that will prevent feed from getting stuck up into that space, hopefully. Sometimes we can widen the space to try to prevent food from getting stuck as well. It really depends upon the horse, the case, and what the goals are. All right, next slide. So periodontal disease not only can be detrimental to the tooth, it can also be detrimental to the sinus. So again, you look back in that top middle picture and there's just a bunch of food sitting there. And then once you get it cleaned out, you realize that, again, there's a massive cavern that is going straight up into that horse's sinus. And unfortunately, in this case, you can see in the lower right radiograph, there is a massive diastema. And unfortunately with this horse, it had worn through the alveolar bone and was communicating with the sinus. And so this horse had a sinusitis. He also had an orosinus fistula. So lots of problems stacked on top of one. Again, why we try to catch these things early. All right, next slide. So sinusitis is something that we deal with. It doesn't, oh, there we go. It doesn't always come from periodontal disease, but it certainly can. This is a video of us lavaging a sinus. So this horse has a a line in his head. This is following a sinus disease, and we've cleaned out the sinus. And now once a day for about a week, usually we will have the owner kind of lavage. And I joke that it's like a giant neti pot for horses. If you look at this x-ray on the only one on the screen, there's lines in that x-ray. And that is because that horse's head is actually pointing down, and that's fluid. Those are fluid lines. And because of gravity, all that fluid has settled. So you can really see them very well on that radiograph. This tooth is what caused this horse's issues. And you can see these are where all of those pink needles are inserted. Those are those pulp horns that I was saying that we really need to be able to investigate on our oral exam. And this tooth had multiple dead pulp horns, which, ended up being an issue. And then there is a draining tract through the tooth where that white needle is. For sinusitis horses, a lot of times, again, we will recommend CT scans because these horses sinuses are very complicated. There's a lot of little bones and a lot of little compartments where infection can hide. So we really want to know where we want to try to be to really get these guys cleaned out. All right, next slide. So tooth decay and fractures. Someone actually asked a really good question before this even started about the difference between infundibular cemental hypoplasia and infundibular caries. So I'm going to try to explain that to you. So a carie is a fancy word for a cavity. Caries in horses do not affect them in the same way that they affect us. Their teeth are built differently. So again, they have multiple pulp horns. So all those little black dots, there's 5 little black dots in that tooth. Well, you can't actually see it. Well, you can in the tooth to the left, and there's a small red arrow. So that is another black dot that is not a pulp horn. That isn't the infundibulum. So that the infundibulum does not have any nerves, blood supply, anything like that. But what can happen, it's a pocket that's supposed to fill with cement. Sometimes during development, for one reason or another, they don't. That is infundibular cemental hypoplasia. So you just don't have enough cement to fill that hole. Now, when it becomes a carie is when that when that tooth erupts out enough and they wear it down and that hole becomes exposed, and then feed can start getting stuffed up into there. Usually these are not a problem for horses. Most horses have them to some extent, and we usually just monitor them. So this tooth on the left, that is not something that I am worried about at all. That tooth looks totally fine. If you look at the second top picture, that tooth has a lot more going on. So all those other little black dots have now disappeared because they've been basically eaten by that giant area in the middle that's full of food. So that tooth is a lot more concerning and definitely warrants radiographs. This other tooth here, the second picture, that tooth has actually lost structural integrity because the caries got big enough and it has split. So that one also needs to be extracted. This picture with the kind of the greenish background and the white arrow, that white arrow is pointing to the infundibulum. So that tooth was extracted and then split down the middle. So that is what the inside of that tooth looks like. So again, if you imagine towards this where the C is written, that kind of track is getting more narrow as it goes down. And if that actually closed up, that infundibulum would not have feed packed in it. So that's the only difference between hypoplasia and a carie. But usually, again, these don't cause issues with horses except for when they do. And the best thing that we can do is just monitor them. And if we see them getting markedly worse, then we can kind of address them. All right, next slide. Tooth fractures, these just happen sometimes. Clients always ask me why, and I always joke that if I knew the answer to that question, I would not be in their barn in Massachusetts in February. I would be drinking a margarita on a beach. So I don't know. Sometimes there is just a defect in a tooth. Sometimes they might just hit something wrong. Sometimes there could be a defect way down in the tooth, and it doesn't hit that defect until it erupts to a certain point. So that tooth could be fine for years and years and years, and then all of a sudden there's a weakness, they bite down, tooth fractures. Now, with fractures, radiographs are usually indicated. So this little fracture here in this tooth there on the left doesn't look like much, and sometimes it's not much, and the owner wasn't very impressed with it, but I told her that we really needed to do radiographs because I did not know how deep that fragment went. And sure enough, if you look at the center radiograph, it went all the way to the tooth root. So that was not a tooth that was going to stay viable. That was a tooth that was going to cause a lot more issues if it didn't come out. But we have no way of knowing that from just looking at the surface. All right, next slide. Okay, so oral masses, yet another thing that we look for. Sometimes these can be due to trauma. Sometimes it can be chronic irritation. Pardon me. Sometimes it can be neoplasia or cancer. Depending upon what it is, sometimes biopsies might be indicated, so that we can really make a determination as to what it is and what we're dealing with. But this is something else that we do find. And then, time to diagnose it and figure out what we're dealing with and go from there. All right, next slide. Incisor and canine disease. So, this is where we're going to talk about some EOTRH. There are some other things that I'm just going to cover real quick. Sometimes the top left picture there is actually a canine that's covered in some excessive calculus, and the middle picture is once that calculus has been removed. So that can be very satisfying. This can be an indication of disease. It can also just be because sometimes geldings like to get a lot of calculus on those lower canines. It's kind of where the saliva sits and where it pulls. But they can have a lot of abnormal calculus that can be an indication of disease. The lower left picture, that is a tooth that I would suspect, based on an oral exam, has changes associated with EOTRH. And if you look at the next radiograph, that circled in red is that canine tooth, and it definitely has some abnormal changes. And so what made me say that from looking at that first picture is it's got some subgingival swelling. There's some little red dots. Those are petechiation. Sometimes they'll get what looks like a little pimple, and you can put a probe in it, and sometimes it's a draining tract that can go all the way to the tooth root. So it may not look like much, but those can definitely have some big consequences. There's also, you can look, the gingival margin of that tooth does not look healthy. So that's one of the, we're going to talk about EOTRH more, but that's an example of EOTRH. And then the other thing that we often see with incisors is they can have some pretty significant malocclusions, and they can also have retained deciduous teeth that don't erupt, or I'm sorry, that don't shed when their permanent tooth comes in. So that can be because if they are slightly offset when the permanent tooth starts to erupt, the deciduous tooth doesn't get the appropriate signaling for the connections and the tooth root to break down. So again, this is a reason that young horses should be looked at, because a lot of times if we can actually remove these teeth before it's a problem, we might be able to correct it. But only if it's a problem. Otherwise, they'll shed these on their own and they don't need any intervention from us. All right, next. So EOTRH, everybody had questions. So we do not know what causes EOTRH. There's a lot of really smart people working on it, but they don't have a clear-cut answer yet. What we do know about it is it affects older horses, usually horses over 15. I've seen the disease process not start in horses until they're much, much older. And occasionally, every now and again, we see it start in one a little bit younger. It usually affects incisors and canines. Less commonly, we will see it in premolars. And every now and again, I think we've had 2 horses where we've seen it affecting kind of the whole mouth. So this presents itself in 2 primary ways, and one is tooth resorption, which is basically those teeth get infected and they get tiny abscesses, so pockets of infection. And then there is the hypercementosis part of this, which is where basically their body recognizes that they are kind of eating their own teeth and tries to correct that by laying down a bunch of extra dental material called cementum. So if you look at the left top picture, that horse, you can see at the gum lines, it does have a little bit of excess calculus. Overall, though, the teeth of that horse, the gums aren't super inflamed. Like there's not a ton of stuff that looks awful. But then when you look at the radiographs, there's on that the radiographs for this horse are directly below that second tooth from the left. There's a big dark spot in the middle of that tooth. Yes, there's a big dark spot in the middle of that tooth. That is an example of resorption. That tooth is infected, it is painful, and it will probably fracture if it's not extracted. There's resorption in the other teeth as well. So this horse definitely has some changes. Interestingly, though, sometimes these horses will have teeth that look okay, and then we take a radiograph because we see one or two little things, and sure enough, the roots below look absolutely awful. And then there's times where we see horses where the outside, the portion that we can see during our physical exam, during our exam of the incisors actually look really awful. And then we do radiographs and the roots themselves don't look terrible. So I know someone asked whether or not radiographs were required, and they really are, because that's how we know when this is bad enough that we need to recommend extraction. So what we base that on is if you look at that second set of that second radiograph on the right down at the bottom, if you look at the canine on the left compared to the canine on the right, those are very different teeth. One is full of infection, and the other one isn't necessarily the healthiest tooth in the world. It's got some issues. I could pick on it a little bit, but it's not causing that horse nearly the issues that the other tooth is. All right, next slide. So some of the things that we see with this, again, it's a tough disease because horses don't show us, they're not the best at showing pain, especially when it comes to pain that will, I feel like some of them are much better at showing pain when they're like, oh, my foot hurts, so I don't have to work today, compared to it's dinner time and I need to eat. Pain sometimes shows up differently. But some things that people do notice is reluctance to, bite things or grasp things. Head shaking, sensitivity to bitting, that we will see sometimes, because when people go to put the bit in and if it bangs off the incisors, that can be really painful. Hypersalivation, again, weight loss. Usually we'll run a small periodontal probe around these guys to see if there are any of those little draining tracts that we can slip into. Sometimes our first indication of this is that during a dental exam, they'll be really uncomfortable on the speculum, which they've never been before. I've also seen this go on to lead to osteomyelitis or bone infections. If you look at the picture of the horse on the top left, that is a massive abscess. And then if you look at the radiograph below it, there's a big circle in that horse's radiograph that is a massive abscess that has eaten away at all of that bone. So these definitely can cause some major problems. And again, if you look at all of these incisors, there's a lot of incisors on there with a lot of dark spaces on them. Those are all pockets of infection. The other thing to remember about this disease is because it's such a slow onset, this doesn't happen overnight. So that's another reason why you usually don't get the same pain response compared to when your horse has an abscess or suddenly they're colicky. This is something that has built up over a long time and they've just dealt with it. So usually clients notice the difference after the surgery. And then they say, oh my God, he's like a different horse, if they're going to notice a difference. That's usually when it happens. All right, next slide. So again, these are not just old horse teeth. Things that we'll notice that may indicate that your horse may have something going on is that you might see the gingival recession, the gums, the teeth look like they're getting a lot longer and the gums are kind of moving up. They can get kind of bulbous swelling under the gums. They can get, like I said, those little pimple things that sometimes they'll actually have pus draining out of them. Redness of the gums, abnormal calculus. The first two pictures on the left are one of a horse with some pretty significant abnormal calculus, and then the lower image is when that has been removed. Resorbative lesions are holes in the teeth, missing teeth. The lower right picture, that is a pathological crown fracture from a tooth that had a lot of disease and then just broke off. And foul odor. Sometimes these horses will really smell. All right, next slide. So once your horse has been diagnosed with EOTRH, what is the next step? So sometimes we notice these changes when they're pretty small. And with those horses, we generally may decide, it's usually a conversation with the owner and about the horse and how they're doing. But we'll make our decision based on our clinical exam, our radiographic findings, how much of these teeth are affected by resorption, and the level of pain that we perceive the horse to be in, and their overall systemic health. Again, usually our feedback from clients on this are improved attitude, body condition. They're still able to work, eat, graze normally. Sometimes they will stick their tongue out because their incisors aren't there to hold them in anymore, but they adjust really quickly. And most clients end up telling us that they wish that they had known that their horse was affected by this years ago, because it really does make a difference for these guys. All right, next slide. So again, awareness is key. Comprehensive oral exam is absolutely needed to diagnose any issues and develop a management plan. Consistent oral examinations and floats can help manage and prevent secondary disease processes. Preparation and prevention is less stressful, less expensive, and less time consuming than reacting to the old skinny horse that cannot eat. And remember that there is a horse attached to the mouth. So dentistry is very, very important. But we also need to take into consideration, someone was asking about old horses and whether or not they could graze anymore if they had worn out teeth. And the answer is yes. Also, there's a horse attached though. So if your horse has, PPID or Cushing's disease, that also may be a conversation with your vet, because even though their teeth can handle it, their feet may not be able to. And work with your veterinarian to diagnose systemic problems as well as dental problems, because old horses are not always skinny horses. All right, next slide. So again, focal odontoplasty, consistent oral exams, and then a lot of times people have questions about whether or not medical versus surgical treatments are appropriate. Advanced treatments we're currently working on. I know Dr. Kelley had mentioned root canals and things like that. Those things are things that sometimes are appropriate for horse teeth, often are not, just because of the design of them, but we're working on them. There's definitely things that we can do to help horses that are younger. Sometimes they'll get caps that are stuck that can affect how teeth are erupting, and things like that can certainly be corrected if they're caught early enough. Orthodontics, we can do it if they're young enough, for sure. And if they're older, that might be done more with odontoplasty, but can certainly be done. And extractions, which these are generally horses deal really well with intraoral extractions, which means the tooth is taken out from the inside of the mouth, not punched out through the sinus or anything like that. But oral extractions, horses tend to deal very well with. And we see not a ton of complications from them. All right, next slide. So some other references in case you're interested. The Horse Owner Education Committee always puts out a lot of great stuff. The AAEP, the American Veterinary Dental College. Lots of good resources out there. All right, Next slide. And just in case anybody would like it, this is the AAP position on dentistry. And one more slide, I think. And then, yes, just thank you to everyone. Northeast Equine Veterinary Dental Services is the practice that I work at with Dr. Limone. The American Association of Equine Practitioners, always working to further the education of vets and owners. And the Foundation of the Horse, those guys actually do a lot of work with student education in vet school. So they'll do wet labs and have us come out for those things. So shout out to them. Shout out to Dr. Kelley and the Horse Owner Education Committee. And yeah, so what do we have for questions?
We could run kind of a speed round with some of these leftover questions. If you all are up for that.
Sure thing. I know Dr. Limone's game.
And also muted at the moment.
Oh, sorry.
There we go.
Okay. Sorry about that. Okay. Yeah, speed round for questions is great. I think that we've answered some of them just in talking through the slides, but I'm going to go through some of the other ones that popped up there. Okay. Is there anything you can do before extraction, or is it usually too bad at that point to be able to do anything about it? I'm assuming this is talking about EOTRH. It depends on the tooth. I will say that most of these cases, by the time we see them, the tooth is past the point of trying to monitor or do anything, and the tooth just needs to be extracted. In some of the early cases that we'll see, there are different stages of tooth resorption. And if they still are at an early stage where it's not affecting dentin or pulp, not affecting the sensitive parts of the tooth, then we can wait it out a little bit and see. But we don't have a specific treatment for these EOTRH cases. Unfortunately, extraction is the treatment because we don't know yet enough about the disease to know how to prevent it and how to treat it other than extraction. Usually by the time there's infection and resorption within that tooth, it's sort of walled off within the tooth, and it's not something that antibiotics will clear up or supplements will clear up or mouthwash will clear up. Some of those things may make the gums look better, but it will not make tooth material come back. So once that process is started, it's sort of, we know that it will progress, and we know that we will be doing extractions at some point. If the teeth are not at that stage just yet, they will be. But every horse is different, and they all progress at different rates. So I don't know if we would be doing extractions in 6 months or a year or 3 years. It really just depends. And this is part of the reason why we try to keep up with our exams with these horses. We look at them at least every 6 months, if not sooner, to keep tabs on changes there. Let's see. Floating the incisors. We don't typically float incisors. They are a little bit different type of tooth than cheek teeth. And unless there's a specific problem, if there's a malocclusion, if there's an incisor that is overlong due to the opposing missing, we generally leave those alone, and they actually wear pretty normally on their own. What kind of signs do you see elsewhere in the biomechanics of the horse that likely point to an issue in the mouth? So I think Dr. Allshouse went over that in some of the slide of kind of clinical signs that they'll show. Sometimes they'll have a head tilt. They'll lean on the bit one way or the other. They may toss their head, do some other things to sort of evade contact. Those are all reasons to do a good oral exam and try to see if there's any changes in the mouth. Can a speculum cause TMJ, irritation, or damage? I mean, there's a lot of things that can cause TMJ, irritation, or damage, but if the horse is sedated and not stressing against the speculum, and the veterinarian using it is not, being overly aggressive and opening it too much. And sometimes we do have to open their mouth quite a bit, especially for extractions. We can have a speculum on for a while. And most of those horses do not end up with secondary TMJ issues. I think that there's a lot that we still do not know about TMJ. And so it's very easy to pin a lot of problems on TMJ when we don't actually have that as a diagnosis for a particular horse. Let's see. I don't feed grain to my horses usually, but I know that a lot of people do. Do you recommend feeding grains that don't use molasses sugars in their formula? I'm guessing that this goes back to when we were talking about infundibular caries. So when we hear the word caries, we think that it relates to sugar and a high sugar diet. Caries in horses are very different from caries in humans and not necessarily related to sugars in their diet. It's more related to that what should be normal cementum filling that infundibula. They have cemental hypoplasia, so there's less cementum there to fill. And then when it gets packed with feed, that sort of erodes the rest of the hard tissue there. So it's not necessarily dietary related with regard to molasses and sugars. Let's see, what kind of damage can be caused by cribbing? They can certainly fracture their teeth. They can excessively wear their incisors and create secondary pulp exposure and abscess from that. My own horse did that. It's great. It's no fun extracting your own horse's teeth. Let's see. As an LVT in New York that has taken small animal dental radiographs, how do you diagnose and look at horse dental radiographs with all teeth on the image? Are there different techniques to single out one side of the mouth? Yes. We have similar techniques to small animal. We just have to make a little bit of an adjustment for angles, as there's a lot of bone and tooth that tends to get superimposed. But yes, we can take very accurate dental radiographs in horses. At what age do horses first need their teeth floated? Generally, we start doing exams anywhere at 6 months to a year, to make sure everything's erupting normally. They're are having all the teeth come in that they should have at that particular age. And then we usually don't start floating them until probably, depending on what they're doing, but probably between 2 and 3. Sometimes a little bit later than that. But even if they're not getting floated, they're at least getting examined. More information on ear teeth. Have you seen them? If so, what was your experience? Yes, we do see ear teeth or temporal teratomas, or I'm blanking on some of the other terms. There's a lot of names for them, but essentially what it is, it's an extra tooth at the base of the ear, and sometimes it will drain a little bit of mucus just out the pinna of the ear. They can be surgically removed. Now that we have CT scans more widely available, that is preferable because some of these teeth will actually be in communication with the brain, and you do not want to go try to extract an ear tooth and end up in, doing brain surgery. Some of these will cause a problem and some of them may not cause a problem. Most common dental issues with foals, I would say probably malocclusions, and retained deciduous teeth. Is there a distinct odor that's typically noticed? Yes, and once you've smelled it, you can't unsmell it. It's kind of a rotted feed smell. Do you see horses that have had oral exams, dental care from young ages that tend to behave better for those procedures later on in life? I do think so. I think the most difficult horses to work on tend to be the older horses that have had a difficult history with dental care, and they oftentimes also have a lot of painful areas in their mouth, so they're certainly valid in being guarded about their mouth. So I think that when they're started younger with kind of a more focal approach, they tend to do better as they age. Do horses with no teeth that can't graze get the same stimulation from eating mash that they would when they grazed? I mean, I think so. They're designed to eat all day, and if they can keep up with that chewing motion. I do think that it's good for their brain as well. We've got a lot of older horses that even though they can't go out and eat hay and maybe they'll have some trouble with pasture, even if they can be munching on cubes during the day or chopped hay and small hole hay nets, so they keep active and keep that eating and chewing through the day. They seem to be happier per their owners, I think. I think that was all the questions. I may have missed some in the chat and I apologize. But you guys asked great questions and thanks for being a great audience. And thanks, Dr. Kelley and Dr. Allshouse. Did a great job.
Did you get the one about the leaf shredder?
I didn't see that one.
That's
Oh, I can do that.
the
Great.
very bottom.
I actually recommend that to clients all the time. So with periodontal disease, if you can make the hay short stemmed, it actually helps those horses a lot because they need to get that forage down to a certain length before they can actually digest it effectively. So, and some of the bagged chopped hay ends up having a lot of molasses and stuff like that added. It's also very expensive. So I have clients who have used leaf mulchers to make the hay smaller. I have clients who use one of those things that you had in elementary school where you could slice a finger off to make it smaller. Also, a weed eater in a trash can, whatever works.
So some say that they fear that the horse might eat too quickly and more likely to choke. Has that been your experience?
I actually think it makes them less likely to choke because the bits are smaller.
Yeah.
And you can still stuff it into like a slow feed hay net if you need to, or some sort of slow feeder.
Okay. Well, everybody go out and buy yourself a leaf shredder. Cool. And yeah, as soon as we're done, I'm going to go brush my teeth. Some of those pictures were a little tough to look at. But my goodness, this was a great session. Thank you so much to all of our attendees for excellent questions. And of course, thank you to our panelists, Doctors Kim Allshouse and Dale Kelley and Leah Limone. We are so grateful for all your expertise. Attendees, remember that this is recorded and will be available to you tomorrow, assuming technology works. Zoom's been a little weird today, but we'll get that on-demand recording up as soon as possible, and we will send an email out to you with a link so that you can watch it again and again and pause and look at all those ooky pictures. So I think with that, I'll just ask my panelists to do one last wave goodbye, and then we'll do the very awkward hanging up on everybody. So bye. Thank you. Really appreciate it, and we will see you soon. All right. Poof.